Well, good afternoon, everyone, and welcome to another installment of the COVID-19 vaccine video series that Temple Health and Fox Chase Cancer Center have put together to provide you with the latest and best information on the COVID-19 vaccine and its related issues. We know that you've been enjoying this series as much as we've enjoyed putting it together for you, and we're very pleased to bring you this afternoon's installment, which will deal with vaccines and ongoing medical treatments. I'm very pleased to be joined today by another expert panel. We're joined by Marty Edelman, who is the chair and professor of the Department of Hematology Oncology and Deputy Cancer Center Director for Clinical Research, and the G. Morris Dorrance Jr. Chair in Medical Oncology at Fox Chase Cancer Center, and also Dr. Tom Thekeda, who is the Thomas Durant Chair in the Department of Medicine, Professor of Microbiology and Immunology at the Lewis Katz School of Medicine at Temple University. Gentlemen, thanks very much for joining me this afternoon. My name's Jeremy Moore. I'm a member of the COVID-19 Vaccine Communications Task Force, and let's get started right now with the first question. So, gentlemen, is it safe to receive vaccine during medical treatment?
Well, I'll talk from the ID perspective. I think we have no reason to believe it's not safe. And I think a lot of that treatment is fairly long, so we don't want to wait forever for this vaccine. So I would say yes.
Yeah, so I heartily agree with that. I think that, and it's not just, my opinion, it's really the opinion of pretty much every professional society. So when it comes down to cancer treatment, American Society of Clinical Oncology, the Society for Immunotherapy and Cancer, and others have all come out with statements that it is not only is it safe, but you should get it regardless of your treatment, whether it's standard or experimental therapy. I think it's essential to get the vaccine. The other question is it safe not to get it? I think this is a extremely safe vaccine, and the potential side effects are, for the most part, minimal. There will always be some side effects, some toxicity, but it protects almost as completely as anything ever has against this disease.
So we skip to the next question. Many types of medical treatment, including chemotherapy, radiation, hormone therapy, and stem cell transplants, can harm the immune function. Which of these have the most potential for harm with respect to the COVID-19 vaccines?
I think that we are accustomed in my field to worrying about vaccines that are live vaccines that could, in theory, become more aggressive in a person with diminished immune function. This COVID vaccines we're looking at now are not living vaccines. There should be no concern about acquiring COVID from the vaccine. These are really not possible to do. So that's the good news. And ideally, the person get the vaccine should be as healthy as they can be, but we understand that everyone is in a different place to start with. And so a lot of people will be getting vaccine at the most vulnerable time that they have. And again, because of the safety profile that Dr. Edelman mentioned, I think this is still something I would go ahead and do. There may be some very fine tuning about exactly when you get it based on certain elements of your therapy. And I think your oncologist or other treating doctor will know those. But in general, the vaccine should be good to go at some point along the way with your ongoing treatments.
So, completely agree. And again, the issue. So first off, we've been doing vaccines in patients with cancer on active therapy for many years. And it's safe. This is not a live virus vaccine. There's no potential to get COVID from the vaccine. And once again, what's the harm? We always speak in terms of the harms of treatment. What are the harms of not being treated? This is a potentially lethal disease, particularly in many of the patients who would be getting active chemotherapy, radiation, et cetera. So in my field, I predominantly treat lung cancer patients. Mortality from COVID is extremely high, possibly as high as 25, 30%. So the question to ask is not what's the harm from the vaccine, what's the harm from not getting the vaccine? And that's a potentially fatal event. So, there's no excuse not to get the vaccine.
Next question. So the vaccines are reportedly about 95% effective at preventing coronavirus infection. Do you think that benefit would outweigh any risk for patients?
Oh, I think this 95% is a wonderful number. We were hoping to get 30 to 50%. So we're well above expectations. The vaccines have done better than expected. So I think 95% is astonishing. And yes, clearly they're so effective that they really should be considered for any person at all.
Yeah. I think the other part of this is it's not only effective at preventing infection, it's effective at preventing severe infection. Essentially, nobody who gets the vaccine develops severe disease and ends up in the ICU. So if you reduce coronavirus to getting what other coronaviruses do very frequently, which is give you the common cold, we'd be in fine shape. And that's effectively what this does. So once again, the harm is not from potentially from getting the vaccine, though certainly every vaccine, every drug, there are no safe drugs. Every drug has potential side effects, Tylenol, Motrin, over the counter, et cetera. But what's the harm of not getting it? It's much, much greater than the potential harm of getting the drug.
Next question. So after cancer treatment ends, does the immune system recover? How is this evaluated? And should people in remission or long-term survivors with normal immune function be urged to get the vaccine?
Edmund, this is yours.
Okay. Once again, essentially this vaccine should be universal with the exception of those who have an absolute contraindication of which, pretty much it's, I think the questions are, have you had Guillain-Barré disease? If you don't know what that is, you haven't had it, so don't worry. The immune system, our treatments vary in their effects on the immune system. Many of them, in fact, are immunostimulatory, including many of what were called classic cytotoxic chemotherapy drugs. We use many immunotherapeutics today. Those patients can get it on active therapy, and patients remission, long-term survivors, definitely should get it, and at the first possible opportunity.
Todd, do you have anything to add to that before we move to the next question?
No, I think that's true. And I think that what's the subtle point is that could there be a timing difference of a few days if you're in a cycle of something or other? And I think the answer may be a few days, but really we're talking about days, nothing more than that.
Yeah, I mean, the only thing would be probably not to get it around the day of your treatment. But even then, if that's the most convenient time, it's not unreasonable. I mean, the side effects, the initial dose is a sore arm for most people. And the second dose is variable with, I've had now 2 doses. The second one, I felt a little washed out the day after. Some of my colleagues couldn't get out of bed, for about a day. They have a lot of aches and pains. So probably, the day after treatment may be a little tough, but, again, the first opportunity to get it is reasonable.
All right, next question. Should people in the ICU get the COVID-19 vaccine?
I'll give that one to Tom.
We've tried to roll this vaccine out initially to healthcare providers, and now we're beginning to extend more into the community, including to nursing home folks. And I think that that's where this question would come up. And, a lot of our folks in the ICU will be there for a day or two as they come back from surgical procedure, and there's not particularly a hurry for a day or two. But there's no reason why they couldn't get it. And if that turns out to be the one time when it's available, I wouldn't hold off for more than a couple of days. So for somebody who's going to get out the next day, I have no problem waiting. I don't want to have a situation where the next day someone has a little fever or doesn't feel as good, and then they worry that there may be something to do with the surgical procedure that may have the fever. We're talking, again, a matter of just days. So in general, it should be okay. But I would say if you wanted to wait until you're just a little bit stronger, fine with me, but get it.
All right, next question. Will vaccination require tighter antibody checks to make sure proper immunity was achieved? Will it require quantitative antibody check? How about T-cell evaluation? Basically a hodgepodge of what are we watching for with immunity levels?
No, we don't even know what those numbers would look like. Someday we will know this. Will never be known, but we don't know. I think that we could look forward to research that looks at the pattern of response to antibody titers or T-cell function, but currently we don't have that information. So I would say, don't even think about it. We just need to get the vaccine into arms. And when we do that, we'll have one. Maybe later we'll find out some of the nuances, but right now, no.
I think it's important to note that we've had vaccinations for, over a century, and we've never monitored these things. And they've been quite effective, smallpox, hepatitis, flu, et cetera. So we don't need to check it. This vaccine works pretty well.
Next question. So how should other immunizations such as flu, DTaP, pneumonia, shingles, hepatitis A and B be scheduled around the time of COVID-19 immunization?
Well, I'll handle this one because we are vaccinators. And I will tell you that as a general matter of principle, you give your vaccines and then you don't do anything for a while before you give any more vaccines, because we think that the optimal response to a vaccine is a series of coordinated steps in the immune system. And if you go a few days or a week after the first vaccine dose, you may bump into a time when the immune system is busy doing something different. So if you're coming to my office for vaccines, you get a whole bunch of them, or you get the one, then we give you a 2-week break, and then we bring you back for more. So I don't like to give these things in a staggered manner, which seems like it might be appealing, but I don't know that we have any information about this particular vaccine and others on the same visit. And then we do that with a lot of vaccines. So I think as we learn more, we'll be able to answer the question better. But for right now, given again, the side effects of this vaccine, we're still learning more about it, I would prefer to give it by itself and then have you come back in a while to get the other vaccines, or get the other vaccines already on the schedule, then get this one as soon as you've had a chance to recover. About 2 weeks is the time frame, I would say, after a vaccine that's worth coming back for another one.
All right, I believe that's our last question. And yes, it is. So it remains for me to thank both of you for taking the time to answer our questions this afternoon. Thank you to the audience for tuning and listening in, and we'll be back again very soon. Dr. Fekety, Dr. Edelman, thank you for your time.
Thank you.
Thank you.